we are going to do a sort of immune boosting treatment for Tom today. He's not suffering from a cold or flu or anything like that right now, but acupressure and acupuncture are most effective as prophylactic treatment. So it's best to boost the internal, what's called Wei Qi, Weiqi, which is your immune energy, before cold and flu season hits. So we're heading into holidays, and so it'll be good to give Tom a little boost as we enter into the colder months. So we're going to do some points along the face and along the neck as well. And we're going to do an auricular protocol. And then we're going to flip him over and we're going to do a treatment along his upper back over the lung area with Moxibustion. Okay, so to start, we're going to just throw a few ear seeds in Tom's ear to help boost his immune system for the season. And these, we'll start with a little bit of acupressure, kind of feeling around for the tender ones, and then we'll place the seeds there. So as a guide, we're going to look at the anti-inflammatory points. So for these, we have the apex of the ear, the allergy point, omega-2, occiput, 0.0, Shenmen, sympathetic, autonomic, thalamus, adrenal gland C, and adrenal gland E. Alright, so the apex of the ear is quite self-explanatory. So for this one, it's kind of right at the vertex here. So I always pinch the top and then, is that tender, Tom?
Mm-hmm.
Yeah. So you do just a little bit of acupressure before placing the seed. And then these are actual literal mustard seeds. So they have mustard seeds as the acupressure tool, and then just a little sticky part. So we're going to pull off so we're going to place this here. And we don't have to be super perfect. So then we're going to feel around for the allergy point. And the allergy point is right underneath the apex of the ear, underneath the fold. So using this point as a guide, I just feel around underneath, right here, tender.
Mm-hmm.
Okay, so we won't press too hard for that one. We'll just place the seed right away. Stubborn little buggers. And then we do sort of like a mirrored point underneath. Ooh. Sorry, Tom.
Mm-hmm.
All right. going to do point 0, which is right in the center of the ear, sort of at the very midpoint of this concha ridge. So right around there. Is that tender?
Mm-hmm.
Okay. Do a little bit of acupressure, but not so much that it hurts them. Okay. All right. So now we place point 0. And as always with your auricular protocols, you want to just stick with 4 or 5 potent points, and as to not overwhelm the ear with too many inputs. So next, let's look for omega-2. So omega-2 is on the outside of the ear, along this ridge here, right around, see, so here is Shenmen, it's kind of directly that way. So Shenmen is right here, then omega-2 will be right around there. Is that tender?
Mm-hmm.
Okay. Is this more tender?
Mm-hmm.
Yeah, okay. So this one is Shenmen, which is also called mirror gate, and it's sort of the most calming point of the nervous system. And so we're going to do Shenmen along with omega-2. So Shenmen is tender on most everyone. Okay, so we're going to decide between omega-2 and adrenal gland C. So we're going to first locate adrenal gland C, which is right on the tragus here, sort of in the tip here. Tender?
Mm-hmm.
Okay. Is that more tender than omega-2?
Mm-hmm.
Okay. So adrenal gland C was more reactive, so we're going to do that one instead of the omega point. Rule of thumb is always choose the points that are tender or reactive. Okay. All right. So this will be a good immune boosting anti-inflammatory protocol for Tom. The points that we selected are also points that are found in the common cold and influenza point list. So point 0, point 0. We have the apex of the ear, apex of the ear. The allergy point was one that we added just because Tom does struggle with his allergies, so it's always a good one. Shenmen is pretty much called for in every single auricular protocol, so we went ahead and did that. And then we did adrenal gland C, which is found in common cold and influenza, as well as allergies right there. And then what else do we have? The apex of the ear. The apex of the ear is pretty much called for in all treatments as well. It's one of my favorite points to use. It's particularly good for high blood pressure as well as anxiety. So next we are going to feel around for a few points on Tom around his sinuses to help boost his immune system. So I'm going to feel around right here. This is Li20. Is that tender?
Mm-hmm.
Okay. Is that tender? Yeah? Okay.
Mm-hmm.
Yeah. Okay. Oh, okay. Down to there.
Mm-hmm.
Okay. Tender.
Mm-hmm.
Okay.
Mm-hmm.
Okay. Which side was most tender? Was it the left or the right?
Believe it or not, the right.
The right. Okay. All right. So. So we're going to put a few quick needles in these points. Let me see. Is this point tender?
Mm-hmm.
Okay. What about this point here?
Mm-hmm.
Okay. And what about this point here?
Mm-hmm. Not as much.
Not as much? Okay. So this is gallbladder 13, sort of in line with the center of the eyebrows here. Gallbladder 13 is sort of right inside the hairline, in line with the center of the eyebrows, and then dew 24 is right inside the hairline, in line with the center. So we're going to start with large intestine 20. So large intestine 20 is just on the outside of the sinus passageways here. And these help to kind of open up the sinuses, but it also helps to prevent sinus infections. So this is preventative treatment today. And then we have stomach 4. And that is sort of right underneath the eyeball, so in line with the center of the pupil. And what we're doing here is we're just sort of following along the sinus passageways here. So this is kind of right in the little hole, the little divot underneath the eyeball. And these also help to prevent allergies, prevent wind invasions, prevent common cold, open up the sinuses, alleviate pain. All right, so then we are going to do bladder 2 next. Bladder 2 is right here and here. And this one I usually just pinch up the edges here. And so those are bladder 2, large intestine 20, and stomach 4. And next we're going to do Tai Yang, which is sort of in the temples here. So I'm not going to touch that before I needle it. All right, and then the next point I'm going to do is dew 24, which is right in line with the center. This point helps to open the sinuses, it helps to stop drainage from happening, it helps to boost the immune system and alleviate pain. And so then the next points we're going to do are gallbladder 13, and these are really great emotional points, but they also work on the upper sinuses. All right. So we're going to let these cook for about 20 minutes, and then we're going to come back, have them flip over, and then we're going to do some Moxibustion on the upper back. Alright, so we're just going to do a few points on the upper back and shoulders that correspond to the lungs. So basically we're going to do urinary bladder 42, urinary bladder 43 on both sides, as well as do 14 and gallbladder 20. So here we have a variety of Moxa tools. These are little tiny cones that we can use on those points. So we're going to do the upper back portion without needles. We're just going to use Moxa. And so these cones are really great little mini cones that we can use on these specific lung points. So first I'm going to do one on do 14, which is a great point to boost the immune system. Then I'm going to go down 1, 2, 3, 3. So then about 3 spinous processes down from do 14 and 3 inches over, we have urinary bladder 42. And then just 1 inch below that, we have urinary bladder 43. These will burn down in a matter of a few minutes. Once it gets to the very bottom, it tends to get quite hot. So, Tom, you just let me know if it gets too hot, okay?
Mm-hmm.
Is this one okay?
Mm-hmm.
So then this is Golden Moxa. It's a very soft, clean burning kind of Moxibustion. So we can place that in our cone maker. And so we'll just let this Golden Moxa burn at his 214. Doing Moxa over his lungs, we're tonifying and strengthening the lungs, we're reducing phlegm, we're boosting his Wei Qi, which is his immune system, energy. Many years ago, when I first started acupuncture school, I treated Tom for asthma, almost exclusively with Moxibustion. And he was able to get off of all of his inhalers in a relatively short window of time. And so I like to do this treatment every once in a while just to boost his immune system and keep his asthma at bay. You would think burning smoke for an asthmatic wouldn't be a good thing, but it's almost like fight fire with fire here. We also like to do a few Moxa cones at governing vessel 4, which is right along the same line as the lower your lower rib and guide it all the way in. Do4 is sort of right at the center of L2, or your second lumbar vertebrae. And governing vessel 4 is sort of where we hold all of our essential energy. And so by warming that point, we're warming what's called the danjian, and that helps to really boost our immune system, our kidney energy, and help us fight infections when they come, or prevent them altogether. So while that cooks, I'm going to put a few more cones on the upper back. So these cones are going sort of directly over his kidneys here, and that also helps to boost his kidney energy. So we're going to let those burn down. We also have these little Moxa sticks here that are kind of like little cigars. So you sort of let it get this nice cherry red. So for this style of moxa, we simply hover it over these lung points, placing our finger near to the skin so that I can feel when it gets too hot. And just doing a sort of pecking motion. Moxibustion is an ancient Chinese practice that is seen to be as effective as acupuncture. If you were to go to a hospital in China, you would smell Moxa upon walking in, at least to the traditional Chinese medicine side of the hospital. They do Moxa for many patients for many ailments. I like to use it most for folks with immunodeficiency, asthma, allergies, folks with cold conditions like infertility due to cold in the uterus. I like to do this over the umbilical or the umbilicus for digestive complaints, so diarrhea more so than constipation, because if you think of the stomach like an oven that cooks your food and breaks it down into waste, if it's too warm or too cooked, you have constipation. So Moxa would not be a good thing to do for constipation. But if you have looser stools or diarrhea, then what we need to do is kind of stoke the fires of your oven, and we can do that with Moxibustion as well. So that would be more of a treatment for the abdomen. But when we have propensity to getting colds and flus, we like to boost the immune energy that's often centralized within the lungs. So doing Moxa over the lungs is a really great method. Always consult your traditional Chinese medical provider for the best treatment approach, because Moxa isn't innocuous. You can definitely do harm if you're doing Moxa for the wrong reasons or doing it for the wrong conditions. You can, sort of exacerbate heat signs. You can cause more constipation. So definitely don't do this at home. And we just get it sort of nice and pink. Alright, so we're going to go extinguish this, and Tom can get on with his day. I'll see you next time.